How does selective photothermolysis remove hair with lasers? Imagine a tiny laser beam targeting hair at its root, destroying it without harming the surrounding skin. That's the science behind how laser hair removal works through a process called selective photothermolysis. This technique uses light energy to precisely heat and damage hair follicles, which are responsible for hair growth, while leaving nearby tissue untouched. The key to this process is the pigment in hair called melanin, which absorbs specific wavelengths of laser light much more than the skin does. This means the laser can focus its energy on the hair, heating it up enough to disable the follicle without causing damage to the skin. When the laser is applied, its light penetrates the skin and is absorbed by the melanin in the hair shaft and at the base of the follicle. Because darker hair contains more melanin, it absorbs more laser energy, heats up faster, and reaches the temperature needed to destroy the hair follicle. This rapid heating causes thermal damage to the cells that generate hair, such as the hair matrix and stem cells in the hair bulge. Once these cells are damaged, the follicle cannot produce new hair, leading to a long-term reduction in hair growth. This process is most effective when the hair is in its active growth phase, which is why multiple sessions are needed. Hair grows in cycles, and only the hairs in the growth phase can be targeted effectively. Typically, patients undergo several treatments spaced about 4 to 6 weeks apart to catch different groups of hairs as they enter the growth phase. Over time, this repeated targeting results in a significant decrease in hair density and growth. In plastic surgery and dermatology clinics, laser hair removal is valued for its precision and minimal downtime. It can be used on various areas like the face, underarms, legs, bikini line, back, and chest. The procedure is generally safe when performed by trained professionals using the right equipment. Different lasers and light devices are available, each suited to specific skin and hair types. For example, longer wavelengths are often used for darker skin tones to reduce the risk of side effects like burns or pigmentation changes. Proper device selection and technique are essential for safe and effective results. The main advantage of laser hair removal is its ability to provide long-lasting hair reduction. Unlike shaving or waxing, which only remove hair temporarily, laser treatments target the root of the hair, leading to permanent or near-permanent results after several sessions. However, it's important to remember that results can vary based on individual factors like hair color, skin tone, and hair growth cycle. People with dark hair and lighter skin tend to see the best results because of the contrast in melanin. Those with very light, blonde, or red hair may experience less dramatic outcomes, as their hair contains less melanin to absorb the laser energy. While laser hair removal is generally safe, some temporary side effects like redness, swelling, or mild discomfort may occur. Rarely, changes in skin pigmentation or scarring can happen if the procedure is not performed correctly. That's why it's crucial to consult a qualified healthcare professional who can assess your skin and hair type, choose the appropriate laser, and tailor the treatment plan to your needs. Remember, individual responses to laser hair removal vary, and it is not suitable for everyone. Always seek advice from a board-certified dermatologist or plastic surgeon to determine if you are a good candidate. They can help set realistic expectations and ensure the procedure is done safely. In essence, selective photothermolysis harnesses the power of light to selectively heat and disable hair follicles, making laser hair removal a reliable, scientifically backed method for long-term hair reduction.